Good afternoon. Thank you for watching our live update for Tuesday, November 17th. Today, I have a good bit of information to share with you about our current situation here on campus and our planning, our next steps. And then Debra Jacobsen has more information about programs and services. After Debra, Whitney Woodruff has some information. Then resident Marty Taylor has something for you, and then Jeanette Ucci, followed by David Curtis from Pastoral Care. So quite a bit for you today. Let me start out and give you an update about relative to the COVID-19 situation. A lot has happened on campus since you last saw me on Thursday of last week. You received some written communications over the weekend about some more cases that we'd experienced, and today try to do our best to bring everyone up to date and answer some of the questions we've been hearing from you since last Thursday. As we've had more of our friends and neighbors here on campus test positive for COVID-19, we have initiated some steps to close our campus again to visitation in order to do our best to contain the spread of the virus and protect the safety and well-being of everyone, our residents, you, and our staff. Thank you for your understanding. We know this is hard. It's never fun to go backward. We knew it was a possibility all along, and we knew we needed to be ready, but we know it's going to be difficult to have some of the programs and services suspended for a little while, but we're very hopeful that the steps we put into place and some of the steps we have coming the rest of this week will help us move quickly towards reopening things back up once things get back under control. Most importantly of the changes, visitation in all areas of the campus is suspended except in those situations of end of life or when there's a compassionate care situation that the healthcare center team manages. So we ask that you do your best to stay in touch with your friends and loved ones via the telephone or via video chat. It is very important to stay connected even if we can't see each other in person. It's what all of us are having to do now that we really can't get together and gather. So we have shared with you in the past a number of times how you can, who you can contact if you want to communicate using a video chat or a compassionate visit. But in any case, if you need help, contact your social worker or your recreation specialist in the area that you live in. We'll do our best to help you with that. Now, to maintain our practice of just being completely, fully transparent relative to the situation we have here on campus, let me try my best to give you the specifics. We currently have 14 residents from the campus who have tested positive for COVID-19. 3 of those 14 came from or are independent living residents, and 11 of the cases are from the Parsons Health Center. 9 of the cases that we have are being cared for in our COVID-19 positive unit, and 4 residents are currently in the hospital. Interesting, but sad, our experience is showing us that we still have a lot to learn about the coronavirus. 3 of our current cases are residents that had previously recovered from being positive and have now tested positive again after 90 days. So the period for an infection is 90 days, and then if you get reinfected after that, they consider it a new case. And so 3 of our 14 are people who've tested positive for a second time during the course of the pandemic. Our most recent case that you received a memo for was a resident of the tower, and our contact tracing, we were able to identify a couple of people within independent living that had been exposed and are quarantined, but thankfully that resident was not out and about a lot over the last couple weeks, and so we don't think the exposures were very numerous, thankfully. We will continue to strive to be completely transparent with everything that we're doing, but you also need to understand that we are bound by federal guidelines under the HIPAA Act to protect the privacy of residents who may not want their condition known. So we're going to obviously abide by that, but we'll keep you up to speed if people's conditions changes. So that's where we stand with residents. We also have 14 employees who have recently tested positive for COVID-19. In addition to those 14 who are out, positive and waiting to recover, we have many others who are out either with symptoms or because they were exposed. I think I heard the number 24, 25 in that range of people that are currently out, either positive or waiting for results. And so they'll be out until they test negative or experience if they test positive or have any symptoms. This shortage, having 20-some staff out right now, is difficult for our teams. And it's really hitting a number of different departments, not all related to Parsons. There are cases in other departments as well. But I want you to know that just exactly how strong the teams are and how hard everyone's working. They will continue and are committed to keeping focused on the care and on the cleaning and disinfection that we need to do to move forward. So we're very grateful for your support and your encouragement, all the words of encouragement to me and to everybody on the team. It's really helpful because these are long days, and it is stressful on everyone to know that we might have more cases that we don't know about yet. So just thank you very much for your support and encouragement. Now let me talk a little bit about the next steps, okay? Our immediate plan, our next steps are part of a plan to get back to a position where we can consider reopening our campus or restarting some of our programs and services. To that end, I have a really good announcement, and this will be helpful as we try to work to try to contain this situation and move forward. This week, all Westminster Canterbury residents, independent living, assisted living, and healthcare, as well as all of our employees, will be tested for COVID-19, either through our routine testing, which we do every week for staff and residents in Parsons, and a point prevalence survey in coordination with the Virginia National Guard. You will receive a point prevalence survey. You will recall we did a point prevalence survey in July. The National Guard was here for 2 days, and they tested everyone, and it was a good experience, really, by all measures. They did a great job, and were very professional, and it was very efficient. We've reached out to the National Guard again yesterday, and they agreed to be here Thursday of this week to test all of the independent living residents. This will help us learn if we have more asymptomatic residents and staff, and it'll be critical to helping us determine our next steps as we move forward. We'll be sharing a memo with more information this afternoon that includes a schedule for independent living residents, virtually the same process we did last time, and then also for staff. And so we'll be testing the healthcare residents and staff internally ourselves, and in assisted living, our staff will be doing the residents in assisted living, and then the National Guard will be doing all of the independent living residents and the independent living staff for the most part. So we hope to have it all done on Thursday. If there's anything left that needs to be done on Friday, our staff will manage that. But the memo that's coming, well, before I say that, for us to move forward, I understand this is very short notice. Thursday the 19th is when we're going to try to get everyone done, and it's very short notice. But for us to get authorization and confidence to move back toward reopening, we need to get everyone tested. That's just no other way around it. We all realize, very short notice, 2 days. But with the Thanksgiving holiday next week, this Thursday was the best day available to us from the Guard. They could be here, and so we said yes. And so we're gonna need everyone's cooperation, and we appreciate you readjusting your schedules to help us with that. The memo that you're gonna get today will explain the process for the testing. It'll provide you with the testing schedule by area campus, and it'll provide you with some direction if there's no way that you can do Thursday. We'll put there'll be some direction in there as to how we're gonna handle that. With the new cases on campus, and especially since there's new cases in independent living, it's really important that we get everyone tested so we can all have some confidence that we're safe. And I want to say a big thank you to the Virginia National Guard and to the Virginia Department of Health for working so quickly to arrange this testing this week. I can speak for Will Blackwell and myself. When we set out to get this scheduled, we did not anticipate we'd be able to do this in 2 or 3 days. But they've made those resources available to us, and so we need to take advantage of it. In order for us to get through the rest of this pandemic, and there is a period here where it's going to be a number of months before we get to the other side of this, and we don't know exactly how long that's going to be, it is critical that we all, staff, residents, and families, commit to doubling down on our efforts to follow the core principles of COVID infection prevention. You see these reminders everywhere you go, but we really need your help and the staff's help in following the guidelines in order to keep everyone well. There's just no other way we're going to get through this without having more of these outbreak situations. It's really important that you wear your mask and wear it at all times when you're around other people, and wear it over your nose and your mouth. Please don't lower your mouth. Please don't lower your mask or take your mask off when you're out of your apartment, and especially when you're talking to others. We see that sometimes. We'll see a group talking or a couple of individuals talking, and someone pulls their mask down to speak because they're afraid they can't be heard. Defeats the purpose completely. So wear your mask. And our staff are getting reminders, and will continue to get reminders to coach you if we see somebody who's not wearing their mask correctly. And if you please take the opportunity to coach your neighbors, your friends, or the staff if you see it, because while it might be uncomfortable to remind somebody, you're doing it for their benefit and your own. So it's really important. We know how hard it is to wear a mask, and how uncomfortable it can be, how hard it is to communicate. But this is our best defense whenever we need to be around others. So please take that and make every effort. Please keep your distance from the staff whenever possible, right? Distance between residents and staff reduces the risk to the resident. We know staff are getting this because they have to be out in the broader community, and then they're bringing it with them asymptomatically. Keep your distance from staff, more than 6 feet. Wear your mask, you should be fine. In the healthcare center, it's a much more difficult situation because staff have to be very close to residents for extended periods of time, and even with a mask, sometimes the spread can happen. So keep your distance. That's probably the second most important thing. And then wash your hands frequently, use hand sanitizer. And then keep your distance and when you do need to be around others, keep your social distance, right? It's okay to be around other people, but stay spread out. And we're strongly discouraging any kind of social gatherings right now. We constantly, and I mean every single day, we hear about groups that are getting together in the evenings or getting together during the day. And this is really risky behavior right now because we don't know exactly who on this campus has been exposed from the cases that we have. And so if you're getting together with the group, it is possible. Now, we hope it's not the case, but it's possible someone in that group could have been exposed and now have the virus, and we don't know it. So now's not the time. Limit your gatherings until we all get tested, and then we can have some confidence that we're safe amongst in groups again. So that's for everyone's benefit. And then stay home if you don't feel well. And lots of people are having symptoms because the weather's changing and there's allergies and all the rest. If you don't feel right, stay home, call the clinic or call your doc, and let's get you tested. It's an easy thing to do, and it gives you confidence, and it keeps everyone else safe. Lastly, we're so incredibly thankful that we have the community of residents we have, and that you've been as willing to work with us through this as you have. That's why we've been as successful as we have been today. Please, please stay strong. It's going to be a tough period here while we work through this, and we're all going to have to stay together and work together and pull each other up, because there's going to be some low moments here, but let's stay strong, keep pushing forward, wear your mask, and we'll get through this. Look for a memo today about the point prevalence survey. It is really important that everyone get tested so we can get back to our new normal as quickly as possible. Next up is Debra. I will see you again on Thursday when the National Guard is here.
Good afternoon. Late yesterday afternoon, we placed a memo in your boxes that was explaining to you some of the changes within our services and some guidelines. We received a few phone calls after we placed the memos in the boxes, as we always do, for some clarification, so I'd like to take a few minutes to do that for you today. Small groups, pastoral care, recreation, and wellness activities have been suspended. This also includes the billiards room. That was one of the questions. Just for now, we prefer not to have the groups together, as John just explained to you. The fitness center and the aquatic center will remain closed until further notice, but please take advantage of the fitness classes that are on TV 970 from 10 a.m. and at 4 p.m. Other exercise videos are also available on Touchtown, the Touchtown app, and it's under videos. If you have any questions, please call 6669, leave a message, and the wellness team will get back with you. But in the meantime, get outside and get some fresh air and enjoy a good walk. Salon services in all areas of living have been closed. Products are available, just like the last time we had to go through this, for delivery by calling 6281. The art studio and the woodworking shop are closed, but if you contact Sarah Abernathy at 6268, she may have some supplies or even some suggestions of some projects that you might want to do during this time. As John mentioned to you, social gatherings in lounges, apartments, hallways, and other spaces are strongly discouraged at this time. This is one of the questions that we kind of avoided the answer in the past, because we did know that there were some small groups getting together, they were social distancing, and it seemed appropriate. But during this time, we're really going to ask you not to do that. Please remember, this is just for now, and we are going to try to fight this recent increase in COVID cases. Residents may be picked up by their families for off-campus appointments. Your family members should pull up, pick you up, and exit the campus. They should not be exiting the car. The Galleria is closed to in-person shopping, but Ginger is inside that shop, and she is available at 1523 Monday, Tuesday, Thursday, and Friday from 10 to 6 to fill some delivery orders for you. If you have your order in by 3:30 in the afternoon, you could expect the delivery to happen that same day. Virtual performances right here in the Sarah Bell November Theater will continue, so please stay tuned for upcoming events. The CVS pharmacy will open to one customer at a time, as they've been doing, The area is well marked for social distancing, so please be aware. Outpatient therapy services will continue by appointment only, and this does include the massage therapist. The clinic is open by appointment only by calling 6231. While in-person dining in the promenade room is suspended, delivery of meals will continue to be available. Instructions for placing your orders for these meals has been placed in your box. Deliveries from friends and families. For independent living residents, you can meet your family member either at the tower or the center entrance and collect the items. Those making the deliveries are not permitted to exit their car and are required to wear the mask at all times. I had questions about UCROP delivery. That continues. They usually arrive on Friday at the center and the tower entrances somewhere around 1 o'clock for residents to come down and pick up and take back to their apartments. For deliveries for assisted living and Parsons Healthcare residents who are not able to collect their deliveries, the family and friends can drop them off at the tower entrance so courtesy services can help you out. Courtesy services is available to you Monday through Friday, 9 a.m. to 5 p.m., and Saturday and Sunday from 10 to 2. So we hope that the families of those residents will take advantage of that. Transportation is available for those essential medical appointments only. We ask residents to postpone any routine appointments until further notice. Residents must wear their masks and distance from the driver during their transport. Grocery runs will continue at the present time, Monday through Friday, with limited capacity for social distancing. We realize this is extremely important to those who utilize the service, but we do ask you to just go on the days that you really need to get some essential items. Sign-ups are available at the tower or the center desk for you. Please continue to follow all the social distancing protocols when entering and exiting the bus. Outside contractors, at this time, Westminster Canterbury asks residents to avoid having those outside contractors that are delivering items or requiring to come into your apartment for service. Limit those who spend time in your apartment to pre-approved essential caretakers. We realize that contract personnel providing essential services could include private duties, some housekeepers, and some time-sensitive financial services, but these must be authorized through the Resident Services Office at 6082. I hope I've clarified some of your questions, and if not, please call us at 6082. And as John said, I want to take the opportunity to say to you, I know this is difficult. It's difficult for us when we have to say no, but I want to tell you one thing. It means so much to us when we get those kind gestures and kind notices and phone calls, not only from our residents, but also from their family members. It brightens up our day and makes it a little bit better as we do everything we possibly can to keep you healthy. That's all from me, so I'm going to turn it over to Whitney. Have a great day.
Hello, everyone. In a normal year, the first weekend of November starts the holiday buying season with our annual Fall Craft Fair. Though this wasn't possible due to the pandemic, many residents have continued their work crafting a variety of items that are for sale through our unique boutique. There is jewelry, woodworking, cards, ceramics, books, and much more. To see what's available, please look for the built-in bookcase in the lobby outside of the clinic. All or part of the proceeds from these sales support our foundation's fellowship fund. I want to thank all of our many residents whose dedication to their craft and to the fellowship program is so commendable. A new addition, a very recent new addition to the Unique Boutique, is an original book by resident Marty Glen Taylor. The cost of her book is $30, and 100% of these proceeds will be given to the Foundation's fellowship program. While we won't be doing an in-person sale of the book or any of the unique boutique items, if you are interested in making a purchase, please call Sarah Abernathy at 6268, and she can arrange getting the items for you and work with you on the payment. So Marty is a published poet and retired educator. Her new book, Benton Point Moments, is beautifully illustrated by members of the Tappahannock Artists Guild. The book's design is by Westminster Canterbury resident Beverly Nelson. The book draws from Marty's life on the shore of the Rappahannock River in Tappahannock, Virginia. Her neighbor, Lucy Negus, wrote the following to describe her book. In her poem, The River Like a Satin Ribbon, Marty writes, "The river, like a satin ribbon, wraps around the country town. In sunshine and in moonlight, it becomes a haven for wildlife." With spiritual sensitivity, Marty shares that wildlife of the river through 21 poems, telling of osprey, eagles, geese, hawks, kingfishers, swans, and the great blue heron. And now I'd like to welcome Marty to read one of her poems.
Thank you, Whitney. I'm really pleased to be part of a craft fair because as a writer, we writers say that writing is a craft, not an art. In other words, you work at it. The poem I'm going to read is fast becoming my favorite one from the ones that I wrote while my husband was in and out of various facilities and then after his death. All of these creatures and critters were my friends and the people I looked at all the time and talked to. The story that goes with this poem is I sleep with my cat. Well, the cat did not come in, and it was 9 o'clock, and I called, and it was 10 o'clock, and I called some more, and finally it was 11 o'clock, and I called, and finally at midnight, I stepped out on the deck, and in my best schoolmom voice, I said, "Kitty, kitty, kitty, kitty," and up bounded on the deck and came running right to me was a fox. Well, I was terrified. I dashed back in the house, and the fox was equally terrified and ran off the deck. So this poem has something to do with that. I named it a female fox, so the title of the poem is Vixen. I was the last person to see her alive, the brash young vixen with long legs who pranced through my yard, a tail hanging from her mouth. I watched as she searched for a place to enjoy breakfast. Hunched over in the daylily border, she tore a small animal apart. I remember her bright, inquisitive eyes, her eager response to my call, "Kitty, kitty, kitty." As she bounded toward me one evening, our surprise was mutual. The law of the wild includes her death too, I told myself when I found her by the highway. The way her red, bushy tail fell over her body reminded me of Marilyn Monroe. The same pose of reckless abandon, the same flowering of life that flames brightly, briefly, then suddenly dies. I don't know if you can see this illustration or not, but the artist did a wonderful abstract of the fox after death. Thank you.
Thank you so much, Marty. And I'd like to thank Marty and all the artists whose work is created for the purpose of supporting the fellowship program. It's so important to keep our fellowship program strong so that each year more than 100 of our residents receive the support that they need, and so that all of our residents have the security and the peace of mind of knowing that they will never be asked to leave Westminster Canterbury due to an inability to pay through no fault of their own. Thank you to everyone who contributes to the annual fellowship fund through your gifts and your purchases. We appreciate it so much, and you make such a difference. Up next is David Curtis.
Good afternoon. I'm David Curtis, one of the staff chaplains here at Westminster Canterbury, and a couple programming notes from Pastoral Care. Please join us for live worship this Thursday, November the 19th at 10:30 a.m. on TV 970. There has been a change to the service. The Reverend Deacon Logan Augustine will preach this week, and that is a change. Also, on Thursday, November the 19th at 7:30 p.m., we will re-show the David F. Peters lecture with Heath Hardage Lee, and that will also be on TV 970. Pastoral Care has a few copies of her book entitled The League of Wives in the Spiritual Library, and we encourage you to check one out. Again, that will be on Thursday, November the 19th at 7:30, a re-airing of the David F. Peters lecture with Heath Hardage Lee. My spiritual director told me a number of years ago that I needed to have scripture for a good day, a bad day, and every day. And today's scripture is a scripture for a day where I need a little comfort. It is the 23rd Psalm. The Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. He leadeth me beside the still waters. He restoreth my soul. He leadeth me in the paths of righteousness for his name's sake. Yea, though I walk through the valley of the shadow of death, I will fear no evil. For thou art with me. Thy rod and thy staff, they comfort me. Thou preparest a table before me in the presence of mine enemies. Thou anointest my head with oil, my cup runneth over. Surely goodness and mercy shall follow me all the days of my life, and I will dwell in the house of the Lord forever. The word of the Lord, thanks be to God. And the prayer that I offer today is the Mi Sheberak, a Jewish prayer for healing. Let us gather in prayer. May the one who blessed our ancestors, Abraham, Isaac, and Jacob, Sarah, Rebekah, Rachel, and Leah, bless and heal those who are ill, especially all who suffer from COVID-19. May the Blessed Holy One be filled with compassion for their health to be restored and their strength to be revived. May God swiftly send them a complete renewal of body and spirit. And let us say, Amen. Thank you for joining us this day. Our next live update will be on Thursday at 3 o'clock. Thank you, and have a wonderful day.